Welcome to the Occupational Safety Leadership Podcast, episode number 319. And this is a part two to the 318, where we sat down with James Walsh of Hyperion Biotechnology, and we really talked about how do you sit down and measure a worker's fatigue? I know that we all at times feel tired, and James really pointed out a very good example to me is that we probably all have a different definition of tired. So it's really, really kind of hard to kind of come to that. And that's why that I like this system. It's all about data. So, but before we really get back into the part two, James, could you go over a little bit about yourself and about the company for anybody who might have missed that in part one?
I can. So it's
Mhm.
Hyperion Biotechnology, and what we do is we objectively measure fatigue through saliva. The technology was originally developed with the U.S. Army and Air Force to support mission readiness. The idea that the Army had really was that we have a population of people that cannot self-report fatigue, and we have no idea how to get a handle on how tiring things that we're doing to them are and how we create a fighting force that's optimized. So we put a bunch of people on treadmills and kept them up all night and gave them heavy cognitive load through research studies and compared pre and post composition of saliva, where we were able to isolate two protein peptides that changed in a significant way from rested to fatigue state. And that was patented. And, we have moved it into pro sports and now into safety sensitive workforces. I think I mentioned this before, but myself, I came out of baseball analytics and data analytics before bringing my science and data geek self to try and work on fatigue.
Mhm. Thank you, James. So we talked a little bit about it on part one. Could you go over how that somebody is going to give a sample and all that about how it's like a like saliva based, and
Sure.
then we'll kind of go over more of like the individual report after that and that kind of
Sure.
stuff.
So I do actually have this in my hand.
Hmm.
It's just it's a tube, and then there's like a little, sponge inside. You pop it in your mouth, you chew on it for 3 minutes, you spit it back in the tube. It gets collected by whoever is, distributing them. They ship them back to our lab. We spin the saliva, and we issue a private individual report to everybody. But I mean, it's very non-intrusive, very easy. There's no blood, it's just you chew on a piece of cotton really and spit it back in a tube and send it to us.
Yeah. I really like that. That's something that as a safety professional, we struggle a lot of times with that when somebody we're going to measure a atmosphere, so we have to put on an atmospheric pump. We have to do other tests, and of course, it's uncomfortable. I don't want to wear it. Why can't you get somebody else to wear it? You hear all the things, but this is really something that's very easy,
That I
easy to
mean, that
do.
was the idea going back to the genesis with the army. It needed to be field ready and it needed to be simple collection. It needed to be something people would do. So all of that kind of went into it right at jump. Was to make it non-intrusive and low lift for everybody involved.
Yeah. Okay, so the person does this. When it comes down to the interval, is that something that's going to be dictated by the company, or it's almost something that's a little bit dictated by the company, but you also know that you have to have a statistically significant sample size,
Right.
at the same time too.
Yeah, that gets into my data love. But yes, it's really about what you're trying to answer.
Mhm,
So it is dictated by the company in the sense that what are we trying to find out? Are we trying to figure
mhm,
out how people recover after overtime shifts? Are we trying to figure out what is the ideal schedule for a group of nurses? Are we trying to figure out what's the travel burden on this group of C-suite executives? It's all going to be driven by that. And we would design testing cadence that would get at the heart of that, like you said, in a statistically significant way where we can definitively answer it for you. So there's different organizations do different things, so we have groups that test weekly. We have groups that want specific studies done over a 6 month period to answer one specific question. We have C-suites that test quarterly. We have C-suites that test monthly. It somewhat depends on what you want out of the data, and
hmm
we will design something that will give you what you want.
hmm hmm But have you seen one that's how could I put it? That's kind of fast and intense. Somebody would do it for 5 or 10 straight work days.
Absolutely. Yeah. I mean, we've done it, you could do it temporarily if you could get a population to opt in, right? So think about, I mean, we did this in Major League Baseball, but so if you think about like a starting pitcher, we did this in a spring training where they're trying to figure out the workload on starting pitchers and when it really starts to spike for each individual. So test before the game starts, test after you pitch 1 inning, test after you pitch 2 innings, test after you pitch 3 innings. Every single time back in the dugout, chew on a piece of cotton, spit it in the
Mm,
tube, mark it. And ultimately, you're seeing where that individual. And when we did this study with this baseball team, we were doing more than just fatigue. We were doing muscle stress, bone remodeling, a number of other physiological factors. But you can start to see where they're starting to incur massive stress, right? Which is, and I know this was on part one, but we kind of talked about the truck drivers, right? And like where it hockey sticks.
mhm,
That's exactly what they were trying to find out with that kind of temporal testing is where does it hockey stick, right? Does it hockey stick at inning 5 for this guy? And it's really number of pitches, not innings, but does
mhm.
it hockey stick at 50 pitches? Does it hockey stick at 80? And everybody's going to be different. And that's another case where the rules built around it are based on assumption, right? So like anybody listening to this is a baseball fan, you hear a lot about like number of pitches thrown, number of innings thrown, and what that does to guys' arms and what that guys does to guys' shoulders. And well, that's true, but every individual is different. And if you don't look at them under the hood on a physiological standpoint, like you're applying a broad set of rules that necessarily don't apply to everyone. And especially in professional sports, when you're paying these everyone's 20, 30, $40 million a year, it's worth figuring out what everybody's individual kind of longitudinal line looks like.
Right. Because with something like that, you're not going to say, I think that it's okay to really push it because the cost benefit is not really going to be there.
Correct. I mean,
Um,
if you think about a guy that you're paying, $30 million a year, so they pay him over 6 months, it's $5 million a month. If he misses a month of the season, like
right.
not only is it poor performance, you're paying $5 million for a guy to be injured, which is bad for everybody involved, including the player. And what you're looking for is like that red line. And that's where like a lot of weekly testing comes in, is you can get that, like that signal ahead of time and you can be more proactive and intervene before something happens. And the same is true, obviously, as it comes to like workforces and like healthcare claims and all of that stuff, is that when people are starting to show red flag signs, you can intervene before and not pay huge downstream cost. Whether
Right,
that's
right,
an incident, whether that's a healthcare claim, whether that's in lost productivity, whatever it may be.
right. Okay. So we talked a little bit about this on the first episode, but a person is going to get a individualized report that will
Mhm.
say, we found the following deficiencies. Here's a couple
Well, it's not
strategies.
deficiencies per se, but yeah.
Ah, okay. Then how would you put it then? But but you're right,
So
it's
we
not deficiencies.
categorize everyone. You'll get something that looks like a bell curve of your
Mhm,
organization, and you're going to see where you are on the bell curve with every test as well as your median score.
mhm,
And and then you're going to be see where you fall in a buckets of your company, right? Your organization, as well as buckets of nationwide. So are you, nothing wrong, not fatigued, slightly elevated fatigue, moderately elevated, extremely elevated. And the extremely
mm,
elevated is really where, the trouble points come in as far as all of those downstream things I'm talking about, is because we talked about this a little on part one, is that if you are in that extremely fatigued category, something is going on, whatever it is. You're either not sleeping, you have terrible diet, you have anxiety and depression, you could have sleep disorder, you could have I mean, you could have fibromyalgia for all you know. Like you could have all kinds of things going on, but
Hmm.
someone who is an outlier compared to the general population, it's not just chance, right? There's
Right, right.
something that's driving that, and that's the beauty in it being science and data, you know, driven technology is that it's irrefutable.
Hmm.
Like it doesn't mean there's something wrong with you, but it means that like something is going on that is likely in almost, in many, the vast majority of cases, addressable.
Right, right,
And you
right.
can bring that person back up, like when you think of a bell curve, like back up the bell curve with the rest of the population.
Right, 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 right. I really like the analogy of blood pressure that you had used before. You know.
Yeah, I mean, I think it's like what, we were talking about how there's no way to really be able to find common ground to talk about something like fatigue the same way there isn't with pain. And I was
Mhm.
saying to you like that you're one of one, right? So you have a certain pain or fatigue tolerance and you deal with it. You just keep going forward because you've got responsibilities and you've got to take care of things and you've got to earn your salary and like all the things that everybody does every day to get out of bed and grind and keep going forward. And so
Mhm.
you deal with your fatigue and you get your responsibilities taken care of, but you have no frame
Mhm.
of reference. So,
Mhm.
like I was
Right.
saying to you, is like
Mhm.
someone with high blood pressure really doesn't know that they're living with high blood pressure until they go and get their blood pressure taken, and their doctor is like, "Whoa, your blood pressure is skyrocket high. We've got to do something about this. Let's talk about your diet. Let's talk, like, let's, like get this back under control." And this is the exact same thing where it's not blood pressure, it's fatigue, but more often than not, someone who's functioning with high levels of fatigue is just doing it because they've become accustomed to it over time. And that's what we're trying to break down is like you don't have to live in a way where you're accustomed to dealing with this level of headwind. There
Right.
are addressable things that will remove that headwind, and all of a sudden you're living an easier lifestyle because you're not fatigued all the time.
Right, right, right. Well, anytime that you can have that data and go back and address any kind of underlying issues, it's going to help out your quality of life then, and certainly not just at work, but overall your whole quality of life.
100%. I mean, the
Mhm.
the goal of this is really to be a win-win, right? Like good for the individual and the employee, good for the organization, good for work-life balance, all of that. I mean, our goal is really, like I've said, is to be a problem solver for everyone involved.
Right, 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 right. So let's talk about. I got a couple notes here. Let's talk about how that a pilot system would go down. So I go ahead, I contact you, and I say, hey, I want the following things measured, you know.
Mhm.
How do we go about doing that?
So
Mhm.
we would, like you were saying, we would work with a client to define what they're trying to answer, right? So
Hmm.
what is it about fatigue that you are struggling to get a lens into and you want to get an answer to? And then we would define a testing cadence to answer it. And you need to come up with a representative sample of your workforce. It's usually 300, 400 people in an
Mm.
opt-in scenario where that would be enough of a statistically significant group of people to be able to look at things like schedule and things like, shift length and all of that type of stuff.
Hmm.
So they would enroll through. I mean, we really handle most everything. A company would give us a list of names and email addresses, and then we would put that in a HIPAA compliant portal on our side, and the employees would get consent from us that, covers all of their privacy and data and usage rights. And I mean, we're not using, there's no DNA, there's no drug testing here or anything like that. We're
Right.
a performance and wellness operation. So we enroll people through that, and then we would set up a testing cadence with the organization as to how they're going to distribute the kits. They get all of the, these little things sent to them, whether they're sent to the individual remotely or whether they're sent to an office and distributed and put on people's desks.
Mm.
But we would do the first test. They would all be collected, sent back to our lab. We would then issue reporting both to the individuals through the same portal, and then we would give leadership de-identified data analytics, that's around the question, that it's around the organization and where there's, where there are hotspots, where there are issues, where there's interesting data that aligns with what they're trying to get at. Then we would run the test in the support and education cadence that I kind of referenced before, where we
Mhm.
work with individuals and groups to be able to get at some of the low-hanging fruit around fatigue and lifestyle and, referring people to assets of the health plan, whether that's mental health, whether that's a physician, whether that's a sleep specialist, whatever that may be, the clinicians on our side would work with individuals to try to get them engaged in trying to, these are people that are in that like extremely fatigued bucket and we would work with them. A lot of times, organizations will put an operational change. Like when I gave that site, the two site example.
Mhm.
If you're going to A/B test two sites and say, all right, well, what if we gave, this break schedule in one site and that break schedule in another? Would that move the needle, right? So you would give that, a 3 month period of time and then we would come in and do the same type of saliva testing. And then we would get another set of data, and you can look at the baseline versus now and have we moved the needle, right? Like,
Mhm.
have we
Mhm.
improved things? Are people recovering better? Is baseline fatigue better? Are people happier? And then again, I know I reference this, but like, that's where you can look at KPIs. Like, are things trending in the right direction? Yes, our fatigue is improving, but is our efficiency improving? Is our productivity improving? Is our safety improving? Is our incident rate down? All of those things tie together in that way.
Right, 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 right. Let me just look at here. So, okay, so we have some baseline testing, initial reporting. We do some interventions. I think we did a good job of talking about that. I really like how it's going to be a individual too, and it's not. We've decided everybody on third shift needs to eat better, and so we're going to do the follow. Now that doesn't mean that that wouldn't happen, but that's pretty darn rare that you'd have a whole giant
No,
set of
yeah, the
people, of
yeah, the
course.
joke
You
we
know.
make is the answer has to be more nuanced than sleep more and eat more
Right,
fish.
right, 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 exactly.
Like it does.
Exactly, exactly. Yeah, yeah, yeah. So let's go right to the I guess probably the one that I really like about this is we already hinted a little bit. It's that it seems really easy to give these samples then. Um and I guess I'm sorry, before we switch gears, how about for a smaller company that maybe only has 30 or 40 people as opposed to 300 or 400? How would that still be significantly, would that
Well,
still
yes,
be
because then you're
significant?
testing
Because
your
that's
whole.
the,
Yeah, when I reference 300 or 400, I'm talking about for a large company. I mean,
oh,
if you
God.
have
Okay,
30 or
gotcha.
40 people, it's perfectly fine because you're not trying to extrapolate it.
Okay,
I'm
good,
talking
good.
more about
Okay,
like, if you think about a company that has 20,000 employees,
right,
you need a statistically significant amount. If you're a
right,
smaller operation, then, it's much more realistic to be testing everybody.
right, 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 right. And it's probably a whole lot easier as a sell, because if you say everybody is going to do it, that's a whole lot easier than saying we decided only the people on third shift, because
Well,
then they kind
yes,
of
you
feel like,
don't.
oh, great, it's me again on third shift. You know?
Correct. Yeah, I mean, that's definitely true. You're not looking to, I mean, if you have issues within third shift, then you have issues within third shift, right? I mean, there's
Right.
not much you can do about that, and that's who you're going to test. And kind of goes back to what I was saying about like what the problem is that organization is having. But I mean, we test a lot of organizations that are smaller. I mean, I honestly like think about a sports team, a sports team
Oh,
inherently
that's true.
small,
Yeah.
like an NBA team has 12 guys.
Hmm.
So we're definitely flexible. The solution can be flex to really whatever the problem is.
Hmm.
I guess
Hmm.
that's the easiest way to say it. I mean, we aim to be flexible in that regard. Like I keep harping on this, but like we're science and data people who are really looking to solve problems, so we'll come up with a testing cadence and a study that will solve your problem.
Right, 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 right. Very good. Very, very good. Let me see if there's anything else on my notes before we wrap it up then too. All right, we've talked about privacy. We've talked about the whole participation. Participation has to be voluntary or
Yeah, it
it's
has to
up
be
to the
opt-in.
company too.
No,
Okay.
it has to be opt-in. So you need people, and there's a lot of personal value in this. Like I said, the goal is really to help people and to bring things into a better, work-life balance. and you're being offered a support cadence and interaction with, world-class sleep specialists and nutritionists and all of that, all for just being part of the company that's willing, to put this in place. And, there's optional incentives at certain companies where, for participation, you might get a gift card or, whatever.
Hmm.
We've
Hmm.
had companies do that. But yes, it's all opt-in and it's all private. The idea is for it to be simple, private, and impactful. And I know a lot of people, especially when you talk about doing any sort of testing for a company, there are certain places that people will get their eyes will start to twitch a little bit, but the goal is to really, make it transparent as to what we're trying to achieve. And again, this is not punitive. This is not meant for like disciplinary action. It's meant for improvement, both for the individual, but also for the systems at place and for the organization as a whole.
Right, 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 right. I like it. I think it's really, really good. Do you have anything else that you'd like to tell the audience before we wrap it up?
I mean, I know it's like it's different and innovative, and we
Hmm.
traveled kind of a different road from, military development. And then I kind of mentioned, when we developed for the military, it was, we're in San Antonio, and then we went
Hmm.
to, and then we started putting it into safety sensitive workforces only, about a year or so ago. And so, a lot of people haven't thought about this type of approach, obviously, because a lot of times things that are military developed are, a little under the, not, a little different and innovative. That's what we're going for. And so it's different and new and all of that, but it's incredibly impactful. A lot of it is understanding, the power of it and how to harness it and how to apply it to your organization. But when you can start to answer questions that functionally, if you ask me, were previously unanswerable with data that you can actually depend on, well, you can start making a lot better decisions, and you can make decisions that are grounded in analysis and data, not grounded in how it's always been done, survey, feel, observation. None of that is great basis for decisions that are impacting lives, safety, all of the things that these policies and decisions do impact. And so, I think it's just more about understanding, there is a different way to skin the cat in some way. And yeah, I mean, I think that's really the base of it.
Yeah, 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 yeah. Very good. Very good. Let folks know how that they can find you and connect and get more info and all that good stuff.
Yeah, sure. It's Hyperion Biotechnology is the company again, and that's hyperionbiotechnology.com, Hyperion biotechnology. And I'm James Walsh, and I'm on LinkedIn. You can find me, and my email is jwalsh at Hyperion Biotechnology. And I said this before, I'm always happy to hear from people that want to engage about it. Like we're not, you don't have to want to buy it to engage about it and talk about it and ask questions and try to poke holes in it. And like we're always open as to that type of discussion and that type of back and forth.
Hmm. James, thank you so much. It was
Oh, I
really
appreciate
great
it, David.
having you.
It's been great.
So, and with that, let's go ahead there and wrap it up. I want to thank everybody for joining me today. My name is Dr. David Ayers. Thank you and have a safe day.